Deep brain stimulation, DBS for short, is a procedure where electrodes are implanted into the brain to treat several movement disorders. Some of the main movement disorders include essential tremor, dystonia, and Parkinson's disease. 3 main locations are targeted, including the subthalamic nucleus, the globus pallidus internus of the basal ganglia, and the ventral intermediate nucleus of the thalamus. These regions are related to movement, and the purpose of the stimulation is to improve negative movement symptoms and replace the dependence on drug interventions. Once these electrodes are put in place, a battery-operated neurostimulator is implanted in the upper chest to deliver electrical stimulation to the target areas in the brain. This neurostimulator acts like a pacemaker, sending electrical signals to the heart. Impulses from the neurostimulator interferes with and blocks the abnormal signals that are going to the brain.
Parkinson's disease, PD for short, is a movement disorder that is generally characterized by postural problems, rigidity of muscles, tremors, and bradykinesia, which is defined as a slowness of movement. These symptoms are caused by the decrease of dopamine-producing neurons in the basal ganglia. The basal ganglia is made up of clusters of neurons in the brain and is known to have a role in controlling posture and voluntary movements.
Dopamine affects the neural pathways in the basal ganglia. When there is not enough dopamine in the system, one of these pathways becomes overexcited, leading to inhibition of the thalamus, which results in the movement symptoms of Parkinson's disease.
Typically, this disease affects older populations, but early onset is possible. This disease affects individuals differently, therefore there is not one single intervention to completely alleviate the symptoms associated with it.
We met with 3 community members who have Parkinson's disease and DBS. Each of the community members have had very unique experiences with both the disease and the implant. They all have experienced some form of proprioceptive deficits throughout the course of the disease. Common examples of deficits include uncoordinated movements, lack of joint sense, and need for cueing. This is in line with what research has shown, that levodopa-resistant proprioceptive symptoms do not improve or may even worsen after DBS. Given our community members' collective issues of proprioception, they all expressed an interest in one day being able to instinctively coordinate body movements without having to think about the motion. Therefore, our chosen research question is, what are the effects of dynamic exercise on proprioception in DBS patients with Parkinson's disease?
Proprioception, also known as kinesthesia, is a sensory system that informs individuals of their body positioning and movement. It tells us about joint movement and position, the timing of muscle contractions, and sensations related to muscle force, such as tension, effort, and heaviness. Dynamic exercise is any type of exercise in which recurrent and substantial body movements predominate. Examples of this type of exercise include boxing, Tai Chi, cycling, skipping, and walking.
After determining our research question, we reviewed the available literature to find out if there is a way to improve proprioception through dynamic exercise in individuals with Parkinson's disease and DBS. From this research, we found that dynamic exercise can improve some symptoms of Parkinson's disease by improving brain function through a few different mechanisms related to proprioception. Assisted cycling and independent cycling both have been used as an intervention to test for improvements in motor function. Both of these interventions showed improvements in motor abilities. However, individuals who took part in assisted cycling with a trainer or motor consistently showed greater improvements. The improvements in motor abilities seen from the cycle training is due to the force of the pedals on the feet, which acts as an external cueing mechanism. The repetitive motion of cycling sends signals up to the brain to trigger correct movements and eliminate freezing of gait, which is typical of individuals with Parkinson's.
Another research study showed an increase in proprioception through the use of Tai Chi. Tai Chi consists of slow controlled movements through a combination of weight shifting, rotation, and single-legged standing in a variety of positions. This was found to be more beneficial than traditional rehabilitative measures of resistance training and stretching. 3 other research studies found that using an exercise program called PD-SafeX was beneficial for increasing proprioceptive abilities. PD-SafeX stands for Sensory Attention Focused Exercise and involves internally focusing on the exercises by keeping the eyes closed. It is designed to improve coordination, feedback, and brain function to help with the symptoms of Parkinson's disease. The goal of this program is to increase functional capabilities of remaining dopamine neurons in the brain. A consistently used outcome measurement tool was the Unified Parkinson's Disease Rating Scale. The scale includes a section regarding motor functioning, and participants in the studies showed improvements in this section of the scale. Examples of the measurements include hand movement, leg ability, and posture.
Overall, the studies we looked at showed promising ways to improve proprioception with the use of dynamic exercise. The interventions of cycling, Tai Chi, and gait training were shown to be beneficial, as well as mechanically assisted exercise and sensory attention-focused exercise, although some of these interventions may be less accessible to the Parkinson's community. Based on the research, we have concluded that almost any form of dynamic exercise could be beneficial for individuals with Parkinson's disease and DBS. Emphasizing the use of external cues and concentrating on specific body movements during the exercises would be ideal to see improvements in symptoms.
While there are current exercise guidelines for individuals with Parkinson's disease, they're not specific to the symptoms of the condition and do not address proprioceptive deficits. Since there is no evidence that DBS improves proprioception, this is an area that still needs further investigation. From the scientific evidence we have reviewed, including dynamic exercise into your routine for 1 hour 3 times per week may have a beneficial impact on reducing symptoms of Parkinson's.